Maybe after Anne. Sophie Mendelson, speaking about the decolonization of university spaces and a kind of this work she's doing at the moment on the post-colonial unconsciousness. That will be followed by Marielle Fanon Mendez France, Franz Fanon's daughter and the head of the Franz Fanon Institute. She will be speaking about the work her father was doing in relation to institutional psychotherapy. After that, we will be turning to Laurence Russell and the work she's doing in the art school in Brussels, followed by a session on institutional pedagogy with Ed Thornton, Jana Graham, and Vendele, who's happily here, Vendele Santos. After that, we'll be doing a look at some of the work that's happening within cultural institutions with Karen Salt and Teresa Cisneros. And then the series will be finished off with Susana Kahlo and her work on Can an Institution Be Militant? Thinking about how these discourses can radiate out. But for today, it's my absolute pleasure to introduce you to Dr. Andrew Goffey. So, Andy, the bio on my phone, obviously. So, Dr. Andrew Goffey is a transdisciplinary researcher at the University of Nottingham. His work engages with contemporary French philosophy and is concerned with institutions, infrastructures, and the contemporary productions of subjectivity. He's translated and written extensively on the work of Isabelle Stengler's, Gilles Deleuze, Félix Guattari, about whose work he is one of the UK's foremost scholars. His recent work has circulated around questions of aesthetics of the institution, engages with the information revolution in the NHS, and globalization of the mundane aesthetics of the creative and cultural industries, as well as the digital commons. He has edited a number of collections, including The Guattari Effect with Eric Elie. He's the author of Evil Media with Matthew Fuller, and has translated books by Félix Guattari, including Schizoanalytic Cartographies and Lines of Flight, Isabella Stengler's and Philip Pignare, The Capitalist Sorcery, David Lapuade, Powers of Time, and Jean-Claude Pollock's Intimate Utopia. His most recent project is a detailed analysis of the connections between the work of Félix Guattari, François Tosquez, and Jean Oury, and the work of institutional psychotherapy, which he'll be speaking about tonight.
Great, thanks Anthony.
All right, thank you.
Yeah, some of those projects, maybe the global aesthetics of the culture industry, I think it sounds like, call it a project makes it sound really big. I think that was one paper that I wrote a long time ago. Anyway, thanks for bigging me up. Thanks Anthony, thanks Jana, thanks to Visual Culture for inviting me. Right, so I want to talk a little bit today about what Anthony described as my latest project. So it was a very detailed analysis of Tosquez, Oury and Guattari. That's what it will look like at the end. I'm at the start, so it's not very detailed yet. Really, I've done a lot of work on Guattari. I've become very interested in the history of institutional psychotherapy, institutional analysis, and I'm particularly interested in what Guattari refers to as institutional creativity, the notion that he takes up again with Deleuze in his book Anti-Oedipus. So more specifically, I'm interested in the conceptualization of the institution as a kind of malleable plastic reality that we find in the writings of Guattari, Oury and Tosquez. So it's kind of historical in organisation. I think there are some interesting questions to be asked about doing the history of this sort of work. It's historical in organisation, but it's kind of philosophical, theoretical in flavour. And I'm really interested in questions like, one, how did institutional psychotherapy understand the institution, both practically and theoretically? It has a conceptualization of the institution, but it has a practice as well. What role did aesthetics play in its therapeutic engagement with the institution as a kind of modelling clay or work in progress? The role of the aesthetic in these three people's writings is kind of complicated. So there's an engagement with art brut and all of that kind of stuff that was big in the 1950s, for example, around Jean Dubuffet. but actually the engagement with aesthetics goes a bit beyond that. And I'm interested in what lessons institutional psychotherapy's insistence on and attention to the Baroque polyphony of institutionally lived experience, what lessons it might have for addressing the very different situation of digitally networked institutions in the early 21st century, since I kind of take it as axiomatic that they are very, very different in lots of ways. Okay, institutional creativity. So with this insistence on institutions as creative, I think institutional psychotherapy, and this is one of the reasons why I think it's of more general interest, IP bucks a trend in thinking about institutions, especially in Anglophone cultures. There's a kind of conception of institutions basically organised as kind of sets of rules. It's kind of the idea of the institution as a rule-bound entity. So as you all probably know, but I was a little bit uncertain when I was sat down to write this about how much you know about this material. And that, as you may or may not know, IP emerges out of the contingencies of civil and world war and is motivated by powerful memories of concentration camps and of the quiet extermination of around 40,000 inmates in psychiatric hospitals during the Nazi occupation. Tosquez bucked the trend here as well by helping patients at the Saint-Alban hospital, which he worked in, avoid this extermination. So I think such contingencies are reflected through IP in its acute sensitivity to the fragile fabric of institutional life and the impact of institutional processes on mental health, and it's reflected also in its willingness, sometimes problematic, to experiment. So it is in many respects for IP, it's the lived experience of institutions and institutional processes that matter, and it's the aesthetic dimensions of sense reality that to a large extent forms the material, the modelling clay, as Guattari puts it, with which IP worked. So for IP, knowing about psychosis, for example, is inseparable from both the collective work on the experience of patients, medical ancillary staff, and the material spatio-temporal arrangements of living with and treating with it. The anti-psychiatric contestation of mental health in the 1960s and 1970s, with which IP is often associated, and which is often informed by Goffman's notion of the total institution, has done much to shape understandings of psychiatric practices of IP. But IP's view of the institution is much more interesting than framing it in anti-psychiatric terms allows. Such a rubric not only simplifies a complex historical reality, but also risks negating the very real experiences of people diagnosed with what we will now refer to probably as mental health problems. Because whilst IP engaged in a critique of the institutions of mental health, it did so with a simultaneous apprehension of what could be created with them. So institutions, it tells us, are not the same thing as psychiatric establishments. This is a distinction that Tosquez absolutely insists on. Institutions concern above all the positive possibilities of instituting, so setting up. It's interested in the possibilities of generating processes that can modulate the experience of institutional life to transformative effect. Now, I think taking an interest in IP and IA today, I'll use these two terms kind of interchangeably. They don't really mean the same thing, but you know, from the point of view of what I'm going to say today, I'll ignore the difference. Taking an interest in IP today raises all sorts of questions, I think, because the constellation of forces that give shape to institutions, in the colloquial sense of the term, is significantly different here and now to the situation that obtained in post-World War II France. Specifically in the field of mental health, of course, there has been a very significant transformation, the process of deinstitutionalisation, if you like, a sort of managerialist, bio-psychosocial taking in hand of service users by service providers, in which new machinery, the DSM, the prescriber's Bible, for example, and the pharmaceutical treatments it shapes, transforms not only the nature of the institution itself, but as far as the nosography, the diagnostic terms that psychiatrists use. So can one still speak seriously of neurosis and psychosis as organising categories when medications, pharmaceuticals, kind of break symptoms down into more complex sets of disorders, I suppose. Well, let's say relations between patients and carers change, the organisation of spaces themselves change, and the relationship between institutions and other practices to the authorities and so on also changes. So just to consider mental health alone, there's been a significant shift which might lead us to think a little bit more, or require us to think a little bit more about what we think about the institution is, where the limits of the institution are, how we link the limits of the institution and the establishment and so on and so forth. And I think these historical shifts matter more broadly still for anyone who thinks that IP might have useful lessons for engaging with institutional practices elsewhere, so universities, for example. So what lessons can one take from a practice engaged in the clinical treatment of psychosis for addressing the precarious, indebted, corporatised, technologised university institution that is plugged into the 21st century knowledge economy? I think this is an important and interesting question. I'm hoping maybe it's something that we might be able to talk about a little bit about in questions afterwards. What I want to do today, though, really is talk a little bit more about the register of the pathic in institutional psychotherapy and its defendants, and more specifically in some of Guattari's later writings. I guess Guattari will probably be a more familiar name to you than Jean Oury, with whom Guattari worked. I'm going to talk a bit about Guattari, and I'll say a little bit also about some aspects of the work of Jean Oury vis-à-vis this idea of the pathic. So my reasons for doing this are several-fold. I think, firstly, it's worth underlining some of the complexities of IP's engagement with elements of thinking about psychosis that have gone largely unremarked outside of the field of psychiatry. Yes?
Sorry, what do you mean by IP?
Institutional psychotherapy.
Cool, okay,
So IPIA, I'll say IP, but I mean institutional psychotherapy, which one would associate more strongly with Tosquelles and Oury, institutional analysis, which one would associate more strongly with Guattari, but there are other people around Guattari as well. But I think it's worth underlining some of the complexities of IP's engagement with elements, and then I'm going to come back to Guattari again. Okay, I think first point to make is that I think it can't be emphasised enough that Guattari's thinking with Deleuze, and later in his own address of the production of subjectivity, is envisaged both as a part of an ongoing effort to get a grasp on the complexity of working with psychosis in an institutional context, and as part of a broader endeavour to address the ways in which the possibilities for subjective reconfiguration might be opened up under heavily technologised conditions of contemporary, what he calls integrated world capitalism. So Guattari is called into service as a thinker of the kind of cybernetic nature of contemporary culture and so on and so forth. And I think there's a lot in his work that works in that direction. But I think people generally have tended to forget that actually, he worked all his life in an institution. He was a practicing psychoanalyst, as well as working with Deleuze, and I think that's sort of disappeared from the reception of his thinking, and it's very much coloured the way in which people read Deleuze and Guattari as well. It's Deleuze first, Guattari afterwards. So I think we need to bear this in mind. So when he's talking about machines in his later writing, when he's talking about subjectification, he is still talking about institutions, and he is still talking about working with psychosis. So I think we need to bear this in mind and acknowledge when reading his work then that even when he's talking about production of subjectivity in a post-media era, when he's concerned with planetary computerization and so on and so forth, these ideas nevertheless remain consistent with and are strongly informed by his exploration of the transformations of libidinal energy at play in the kind of psychopathological phenomena, psychosis, schizophrenia, autism and so on, that were of central importance to him in his lifelong work at the Borde clinic. So the plural semiotic processes which he emphasises as being operative in the production of subjectivity today, when I say today I mean the late 1980s, early 1990s, it's not really today for a lot of people, but I was just finishing being an undergraduate then. But I say today to differentiate it from longer period of history. So these kinds of processes are to be understood as indissociable from a growing emphasis in his work on the pathic dimension of subjectivity, a dimension that is emphatically focused on the existential in a manner that simply disappears when people kind of assimilate his kind of work on ideas to do with the machinic to a sort of kind of recondite form of cybernetics. And this is kind of odd. The pathic comes back in his later work. The vocabulary of existential psychiatry seems very strange in somebody whose work is, with Deleuze in particular, is very hostile to existential phenomenology. So I think it's interesting, even for a Guattari geek like me, to ask a little bit about, well, why has this vocabulary come back into his work, and what is it doing for him that the other stuff wasn't doing? The importance of the pathic is crucial in his late writings, specifically in the schizoanalytic cartographies and in chaosmosis. Guattari even flags up the richness of the phenomenological research out of which the pathic emerges, in a definite contrast with the systemist or structuralist research that follows it. So he's thinking about people like Bateson on one hand and kind of structuralist psychoanalysis on the other. And yet the term only rarely features in the more broadly popularised toolbox of conceptual terms associated with his work. The very insistent manner in which this term recurs, particularly in chaosmosis, is interesting, not in the least for the manner in which it introduces a dimension to the discussion that is missing from kind of popular appropriations of concepts like machinic enslavement that you find in his work with Deleuze in 1,000 Plateaus, for example. I think actually the vocabulary makes much more sense if you're willing to acknowledge that he was engaged with psychiatry for all his life. I mean, it seems a bit strange for people that are used to thinking Guattari starting from Deleuze and starting from French theory as some sort of abstract notional entity. It makes much more sense if you remember that he was constantly engaged with these kinds of issues. So associated directly with the ethico-aesthetic approach to the production of subjectivity that his later writings explores, Guattari's emphasis on the pathic not only underlines his continued insistence on the central importance of an engagement with psychosis as a way to understand processes of subjectivation, but is also suggestive as a way to explore connections with other strands of research in psychiatry, for example. Indeed, within the rich vein of research to which the notion of the pathic refers, which I've loosely grouped under the umbrella heading phenomenological psychiatry, interesting connections are suggestive not only with Kantian aesthetics, Heideggerian hermeneutics, even Gestalt therapy, but also with a conceptualization of life that has obvious resonances with Guattari's work more broadly, and which focuses directly on the field of embodied existence, invested in very different ways across institutions, particularly in early 21st century hyper-technologized global north. For phenomenological, so I've written phenomenological, which is a nicer word, but phenomenological psychiatrists, the pathic is part of a more holistic appraisal of illness in the context of the living being, or an understanding of the living being in its relationship to its environment. And it brings into play considerations of movement, sensation, encounter, and more specifically of contact that I think casts an interesting light on Guattari's work. This is the case as much with Eugene Minkowski's highly Bergsonian phenomenological studies of lived time and psychopathology, so where he talks about the loss of vital contact with reality. This is the central theme of his doctoral research. And it's also equally important in the work of Lippot-Zondi, to whom Deleuze and Guattari refer. So Zondi had a famous diagnostic test that thematized the idea of contact as one of a number of drive vectors in terms of which diagnosis of mental health issues should operate. And his work, Zondi's work, Zondi actually becomes quite important for, particularly for Oury and the work of the Borde Clinic. The pathic was also of particular importance for a number of philosophers and psychiatrists associated with existential phenomenology, and what has become known as Dasein analysis, including Henri Maldini, who was an important interlocutor for Oury on art and madness, and Jacques Schott, who participated in the meetings of, Anthony will be able to tell me, the GTC. I can never remember what it stands for, but it's basically the group whom which Oury was part of, Trotsky was part of, Guattari was part of, Pankov was part of, the group. It's basically where institutional psychotherapy emerged from. I can't remember. Anyway, so for Maldini is a really interesting figure. Maldini, anecdotal. So, and Maldini actually worked alongside Deleuze. For Deleuze nerds in the audience, Maldini worked alongside Deleuze when Deleuze worked at Lyon fairly on in his academic career, and wrote about a number of themes which we also find in Deleuze's work, particularly in The Logic of Sense. So Maldini was an important interlocutor for Oury on art and madness in particular. So for Maldini, the pathic denotes the crucial dimension along which we should understand the human in its connection to the world. It's a dimension that's evident in feeling or in sensibility or in sensing. So there's a very, very strong connection to ideas about the aesthetic in the idea of the pathic. Maldini suggests that qua pathic, sensing is to perceiving as the cry is to the word. And in this respect, he links the idea of the pathic to the idea of what the French call an épreuve, a test or an ordeal or an undergoing, so a test of existence. So the pathic, which is connected with sensing and with sensibility, the movement of life, is inseparable from an experience of undergoing. So it's the connection to the outside world as a sort of undergoing. And it's the necessary correlate of the fact that it's through sensing, which is captured in the idea of the pathic, that we're open to the world. Guattari refers more specifically to Victor von Weizsäcker, who developed an extensive medical anthropology that he calls pathosophy, and to the distinction that von Weizsäcker makes between the ontic and the pathic. But it's perhaps in the work of Erwin Strauss that we find one of the most interesting resonances more generally with IP thinking. But it's to Strauss that we owe the characterization of the pathic in terms of sensing, and as such, it denotes a kind of originary affectivity. So if we think about kind of debates around affect studies and so on and so forth, phenomenological psychiatry already has a strong engagement with affect, which is framed in terms of aesthesis. So originary affectivity, which is really effectively the movement of a living being in its opening onto the world. The pathic here is not something that is to be understood as subordinate to knowing. This is a really important point, because kind of thinking about experience that starts from what von Weizsäcker refers to as the ontic, kind of space-time coordinates, the what of existence rather than the how of existence, is a surefire way to miss the pathic. So the pathic is not something to be understood as subordinate to knowing, and as commentaries on Strauss and the Japanese psychiatrist Bin Kimura have pointed out, sensing forms a non-thematic and spontaneous capacity to enter into contact with self, with others, and the world. And it's a bit like Merleau-Ponty's idea of the flesh, in the respect that it's prior to the subject-object distinction, on which knowing is typically thought to rest. More broadly for Strauss, sensing marks an endeavour to grasp the living creature as inseparable from its environment, in a way that has much in common not just with von Weizsäcker, but also with Jacob von Uexküll, whose work, again, Deleuziana issue. Deleuze and Guattari refer to von Uexküll and his work on tics and their relationship to the world. Renaud Barbaras, in a useful commentary, has pointed out that for Strauss, the genuine sense of pathic experience points back to an originary affecting beyond activity and passivity that is nothing other than desire. Indeed, the word precisely indicates the mode of relationship to the world that underlies sensing. insofar as it denotes an approach, a drawing nearer to the world. So this is what a vocabulary drawn from existential psychiatry, phenomenological psychiatry. This is how it kind of characterises the idea of the pathic, and it's connected to phenomenological commitments about the subject and so on and so forth. So it might surprise us a little bit, given Guattari's hostility with Deleuze to phenomenology, and given Oury's close engagement with Lacan. But a reminder of what is involved here with the notion of the pathic, I think, is important for engaging with what I think Guattari and Oury are trying to do specifically vis-a-vis psychosis in an institutional context. And here it's that idea of the environment, the relationship, the inseparability of a subject from its environment, from their milieu, that becomes important. The pathic registers an indissociability of aesthetic dimensions of sensation and movement that is constitutive of the embodied field of experience. Life, then, is indissociable from the milieu in which it unfolds. It's being in the world, to use that Heideggerian term. For Guattari, bringing back the existential into the question of the production of subjectivity, which is what he's doing when he's talking about the pathic in his later work, offers a way of focusing on a dimension to the production of subjectivity that is all too easily overlooked. Pathic subjectivation, which he sometimes glosses in terms of a logic of non-discursive intensities, and associates with an extension of Lacan's idea of the object, little a, into a thinking of what he calls partial enunciators, is, as he puts it, occulted in capitalism. It's what information technology draws on, but is constantly hiding, because information technology is something that is thought through and operates in terms of the idea, the ontic idea of things that we know about rather than things that we sense and experience. The pathic provides Guattari, I think, with a way of addressing the production of subjectivity in terms of enunciative processes which the semiotics of coded systems presuppose but can't put into play or can't articulate. Arguing, with an unacknowledged nod to Tosquelles, that subjectivity is polyphonic. The idea of polyphony is very important for Tosquelles. He reworks Klein's idea of the part object, or Lacan's object little a, in proximity with Mikhail Bakhtin's work on literary form to talk about the idea of partial enunciators. In doing so, Guattari is aiming to correct the personological framing of enunciation in psychoanalysis, consequent on its privilege of the one-on-one dialogue. Not just to render perceptible the complex plurality of textures of subjectivity in a heavily technologized environment, but also to point towards the unavoidably precarious nature of the achievement of its coherence under the logic of production for production's sake in capitalism. So the point I'm trying to make here is I think that when Guattari is talking about pathic subjectivation, thought back into the institutional context is really providing him with a way of going back to thinking about surroundings and thinking about the importance of surroundings, of environment, in shaping subjectivity. And it's important to understand that in an institutional context, subjectivity is not necessarily an individual thing. It's subjectivity as a dimension of the institution itself. So I think the insistent nature of his emphasis on the existential here offers a way to address an aspect of the functioning of kind of contemporary integrated world capitalism, so the constant production of technological means that brings thinking in terms of a more embodied logic of gesture, of movement, of posture, crucial dimensions of the non-discursive, into productive contrast with technologized dimensions of the milieus of 21st century capitalism. The indissociability of the aesthetic dimension of sensation and movement that phenomenological psychiatric thinking about the pathic registers, in this sense offers an interesting set of resources with which to explore aspects of the everyday, whether in institutions or not, that are all too easily overlooked. Work with art, for example. So we find it there. We find it in the seminar that he writes, collection of seminars that he writes on alienation. So alienation was something that kind of French Marxists didn't like to talk about a lot after Althusser, but he's got a very interesting, he insists on going back to it, and uses a discussion of alienation as a way to come back to what he sees as the specificity of the psychiatric institution. So Oury's engagement with the Pathic then draws our attention similarly. I mean, in many ways, Guattari and Oury are very different in lots of ways. Oury's very, he's got the Lacan bug. He's very much, reflections on Lacan's work are very important in his thinking. So there's an emphasis on language which is different to that of Guattari. And yet I think there are some very interesting parallels between the two of them. So he draws our attention to the ways in which his practice within IP goes to work on the environment in which the treatment unfolds. And there's a lot of discussion, and this might be something that we can pick up in the questions. There's a lot of discussion in Oury's work about translation and about what words we should use to think about what it is an institution and what it is about an institution, the quality of the institution that matters from the point of dealing with people with very serious mental health issues. So it's about what an institution might be if an institution was hospitable. And so there are real questions around vocabulary. And one of the terms that he uses, and he does this indexing the idea of the Pathic, is the idea of the ambience within the institution. Without the right kind of ambience, I should say, French style, ambiance in the institution, there is no chance of generating the kinds of conditions in which transference, which obviously matters in the treatment of psychosis, won't take place if you haven't got the right kind of ambience. Okay, so it's a crucial point for Oury, which he underlines on numerous occasions, and I think was also powerful in early IP endeavours to bring psychoanalysis to bear on the institution. And the issue here really concerns the extraordinary sensitivity to psychotics, and I apologise, I'm going to use that as an umbrella term. Obviously, there's all sorts of things encompassed within that label. So the extraordinary sensitivity of psychotics to their environment. One has, he says, to situate illness in relationship to an ambience, which is precisely what the Pathic concerns. Given the dissociated qualities of problems of psychosis and the troubled relationship that is to be found in problems of psychosis, it is in relationship to the ambience of the institution that the collective that works the institution has to operate on. You have to generate ambience, different kinds of ambiances within the institution, in order to give people who have a very troubled relationship to language. So, this is where Oury is Lacanian. So the psychotic is somebody who has foreclosed the name of the father. But it's a troubled relationship to language that operates at the level of what analysts would call primary repression, that one needs to work. And to do that, you have to work on the environment. You have to work on the environment, the ambience of the environment within which the people you are treating are living. If not, there is very little chance, there's no affordances within the institution for a desire on their part to emerge. Okay, so this has to do with the dissociated nature, in some respects, of psychosis. Phenomenological psychiatric thinking insists that pathologies do not lie in opposition to the normal. I think this is also worth pointing out. So a pathology here is not pathological in relationship to the normal. A pathology is pathological in relationship to the Pathic. Right? So it's a trouble. So when we talk about people being cut off from the world, as in, say, autism, it's a kind of bit of a stereotype, but when you might talk about autism in that way, someone having lost contact with reality, or schizophrenic having lost contact with reality, what we're talking about for phenomenological psychiatry is a loss of the kind of contact that is inherent in this idea of the Pathic. The Pathic is this sort of other side of everyday experience, which is a kind of receptivity towards encounters and so on and so forth. So phenomenological psychiatric thinking insists that pathologies are a troubling of the pathic. And this is a point that Oury often insists on. It's a problem that has to do with a receptivity to encounters, a receptivity to the surprise of encounters. So this is what contact is about. The contact can arise out of an encounter. And it's important for Oury, and it's important, I think we can find this in Guattari as well. It's important to manage encounters, because if you don't manage encounters for people with serious issues of psychosis, you won't generate that kind of contact that is inherent to this idea of the pathic. Right? It's about establishing the possibility of giving somebody a way of opening up to the world. You have to do this by managing encounters, and this is what ambience is about for Oury. So this dimension of the encounter, and this is of the encounter and of contact, leads in, and this is not without problems, or led him at least at one point to a characterisation of the Borde hospital as a space for encounters. And this is it doesn't really work in English, but an espace à rencontre, I think, was interpreted by a journalist that Oury was talking to as meaning something a little bit like a brothel, right? A space where you go to have encounters. These are sexual encounters, what the French might call a ballet and ballet rose. And this led to some concern that what was going on at this place. This is a brothel where people were being encouraged to have sexual contact with each other. But crucially for Oury, working on the pathic dimension of ambience, which he also refers to as colour. He says that institutions have a colour or have a colouring. Different parts of an institution have a different colour, which he associates with the idea of a sort of an affective tonality. So working on the pathic dimension of ambience or of colour is about shaping the different spaces of the institution so as to afford the possibility of what he calls, after Gisela Pankov, who was also very important in the early work of IP, what she calls transferential grafts. Right, so this is not transference in the sort of psychoanalytic sense of the kind of artificial repetition of a neurosis, but a transferential graft for a psychotic, for somebody who has serious problems with language, is a partial opening. It's about the possibility of an emergence of a desire. So it's about the fragile emergence of the desire on the part of a patient in the contact between patient and carer. From this point of view, then, an institution has to be complex. It has to be baroque. It has to be multidimensional. The ambiences of the different places that make the institution up have to be different. And this is not so that they feel nice or feel welcoming, but it's so that they generate, on an unconscious level, they generate the possibility of something happening. Okay? So it's as much in the difference between ambience, between different parts of the institution, that the kind of transferential effects that Oury is interested in for the purposes of treating psychosis are generated. It's not exactly, as you've got to remember here that Oury is a Lacanian to some extent. It's not exactly that different spaces in the institution have different signifiers, right? So we talk about the signifier, what the kitchen signifies to to somebody who works in the kitchen. There was quite a lot of work early on in IP, which had to do with how one might apply kind of structuralist psychoanalysis of the Lacanian type to thinking about the institution, and people talked about situemes as a way of trying to get to grips with how it was that actually something happening in the kitchen. There might be an analytic possibility of something happening in the kitchen. So this is like the signifier thing that Lacanians were very interested in. So it's not exactly, so different ambiences within an institution and the transferential effects they create, it's not that they have different signifiers associated with them, but it's that the differences of ambience lend themselves to a distinctiveness that facilitates the emergence of a desire. So actually it's I guess it's what psychoanalysts might talk about as structuring, in some respects, structuring an environment in order that something might happen. Right? If something is sufficiently distinctive at the level of pathic, there's a differentiation which is not yet language. It raises the possibility of the installation of a language, something being enunciated within language. So generating ambience, and hence the possibility for transformation, is important. It's really, really important to Oury's work, and it's really, really important for the work of the collective as well. So the people that are involved within the institution. Ambience is not something that is. This is where there's a kind of, I guess, a fairly big difference with a lot of the kind of phenomenological register. It is something that operates at an unconscious level on the part of the practitioners who are working within the institution as well. This is why we have to differentiate something between institution and establishment. So, and I'm going to read you a lengthy quote here from a seminar of his on the idea of the collective, and we'll see how much of it makes sense. In established structures, and so what he's trying to do here is he's trying to talk about what you have to do, how you might generate a process within an institution based on the idea of these little openings, the little glimmerings of desire, the emergence of a desire, these transferential graphs. In established structures, he says, it's not at the level of a meeting within the institution, it's not at the level of an instance or an agency in the psyche, it's not at the level of a group or a person, that there exists something that they would be able to treat what is in question in the very efficacy of this collective reality. It's also at the level of what I have called, he says, the abstract machine, the abstract operator, or the collective. In order for an ambience to be modified in a collectivity of, for example, 100 elements, so I think the Borde hospital, 100 patients, if there are only 6 or 7 elements that are modified, which make for little graphs, so little transferential graphs, that is not enough for struggling against the riding tide of entropy, this sort of pratico-inertness. So it's kind of the inertia of the institution will kind of settle back in if you haven't got a sufficient number of these little possibilities of opening amongst patients and in the relationship between patients and staff. One notices that starting from 15 or 20, sometimes, straight away, there's a change of structure, a modification of the ambience, a sort of bifurcation in René Thom's sense. But in order for there to be bifurcation, there has to be a sufficient number of elements. And also, it's absolutely necessary that each one of these elements, each one of the persons present, remains themselves, that there be no amalgamation, no sticky, so word collant is the expression used, no sticky, which can mean opaque or clingy identification. In other words, it's important to create a heterogeneous group. So you have this idea of the pathic, you have the idea of the kind of generating different atmospheres or different ambiances within the institution in order for something to happen, in order for there to be encounters or contact. And you only get that if you have a group itself within the institution that is itself heterogeneous. If everybody kind of identifies with a leader in the group, for example, it's simply not going to happen. So that's a long quote. What I wanted to underline here is that the affective, the pathic, or the colouring of institutional spaces is inseparable from a rather complex and highly delicate articulation of collectivity. And there's lots of really, in Oury's work, there's lots of really quite, on the one hand, there's a lot of kind of very, very abstract theorization, but there's also an awful lot of very, very concrete empirical description of, working with a particular patient, a particular episode when somebody wants to go to the shops to buy cigarettes, or when a patient from the Côte d'Ivoire wants to go back to the Côte d'Ivoire. He goes on at length about this particular patient who comes to him and says, look, I want 3 million francs because I want to go to the Côte d'Ivoire and I want to set up an association, a club, a bit like the club within the Borde clinic. and Oury kind of, it's like 3 million francs. He doesn't say you've got to be kidding, but then you get a long discussion of why working with this patient, talking it through, helping them set something up, why the process of the patient being allowed to take a car and drive to the Côte d'Ivoire matters from the point of view of the relations with other people within the institution, not just the patients, but the staff who work in the institution as well. All of these little elements then become really, really important because they have knock-on effects for other people within the institution, and they make certain kinds of treatment possible that wouldn't be possible otherwise. So there's I mean, I guess you can probably see there's also a really significant issue about alienation as well, because Oury acknowledges very regularly that people in the hospital, they often don't want to do this. You might have a member of staff that doesn't want to. This is not my job. It's not my job to get a sense of what's going on everywhere. It's not my job to be attentive, right? That's for the doctors to do. But a lot of the work within the institution is about dealing with that and dealing with those kinds of forms of alienation. It's kind of a complicated, and he acknowledges that this working on atmosphere, working on the pathic, is incredibly complex, and you're always, in a sense, starting from zero. How am I doing for time?
Okay, like another 5 minutes.
Oh, okay. Okay. Well, I'll come back to Guattari a little bit here. Maybe because I guess some of this is quite abstruse, so maybe it can be made a little bit more concrete in the discussion. So I want to say just a little bit something about the idea of consistency that we find in Guattari's work, later work in particular. So the insistence in phenomenological psychiatry on the pathic dimension of contact, I think, finds quite a strong resonance in the idea of consistency, or the problem of consistency that occurs in Guattari's work. In broad terms, the problem of consistency is one that's effectively raised in Anti-Oedipus with this kind of the idea of the trans-individual pre-personal logic of desiring production. In the context of the institutional treatment of psychosis, desiring production is, and I think this is, again, is an interesting resonance, desiring production is associated precisely with the possibility of generating transferential graphs. So Guattari uses that term that comes from Pankov to talk about the work of desiring production. Transferential graphs, in which some or other aspect of the institution, as I've suggested, facilitate the glimmer of an opening in the life of the patient. And the challenge of transference in schizoanalysis is precisely to get desiring production moving without the transferential re-territorialization on whole persons that linguistic personology encourages. Part of, I think, Guattari's interest in the pathic is this keeping away from too precipitous of falling back on language. In his later work, in his thinking about chaosmosis, the issue starts to be framed in terms of what he calls a theory of existential appropriation and generalized existential transference, for which the idea of the prise, or the taking or taking on of consistency of affect, is central. Clearly, in a situation in which subjectivity is produced, as it always is for Guattari, in which it's not grounded in some central unifying principle, the question arises as to how different elements, so the essentially heterogeneous, what he calls the essentially heterogeneous multi-centered processes of partial enunciation, acquire unity. How do these elements acquire unity? And we can see there already you've got something that is a little bit approximating what Oury is concerned with in the collective, in this idea of the collective as an abstract machine, and this idea of how things might kind of take on a life of their own. Do these elements do so in such a manner as to open up or close down possibilities for transformation, and in terms of what kind of existence? This idea of the prise de consistance referred to throughout schizoanalytic cartographies in particular is of central importance. Not in the least because existence for Guattari is itself nothing other than the consistency of a constantly modulated ensemble of processes, ontologically speaking, an ongoing, precarious, fragile production. In the context of the pathic and that idea of contact that I mentioned associated with it, it's worth noting the polysemic nature of Guattari's use of the term prise here. To be sure, when he talks about a prise de consistance, there is, I think, implied a deliberate contrast with the prise de conscience that we associate with Marxist politics. But associated with consistency, the term has an evidently more material set of connotations. So variously translatable as hold, grip, taking, but also as meshing or even being plugged into, because a prise in French is also an electric plug. The term has strong connotations both of getting a hold on something and of establishing a connection. So the resonance is here. Again, I think maybe you see here, again, the resonance is with the phenomenological psychiatric thematizing, pathic thematizing of contact are reasonably evident. In a context in which subjectivity is produced, one has to be careful when recurring to the undercurrent of the language of gestural contact, to which the idea of the prise leads us. The taking on of consistency, through which a partial enunciator, read problematically the transferential graph in Oury, comes into existence within processes of production subjectivity, sits between subjective and objective, and it's not necessarily personal. So thinking about it in terms of gesture can be a little bit problematic. There is a strong sense for Guattari that what is involved here is a process of activation. Indeed, to the extent that conceptualizing affect in terms of pathic subjectivation is what he calls a complex subjective territoriality of proto-enunciation, kind of distinctive Guattarian vocabulary. It's something that is not passively submitted to, but something the existential appropriation of which opens up new possibilities. However, a considerable difficulty attaches to this appropriation of affect. So what I'm saying here, when Guattari talks in his later work about complex affect, when he talks about the kind of colouring of affect, the atmospheric quality of affect, when he talks about the pathic diagnosis of psychosis, he talks about kind of pathic transference. I'm suggesting here that he's still very much engaging with those ideas that we've seen already a little bit in Oury's work. But there's a considerable difficulty attaches to this idea. The non-discursive intensities of the pathic in Guattari's work cannot be apprehended from the outside. They're only susceptible of an apprehension that is itself pathic, such that knowledge of them is itself existential transference. You have to live with psychosis. I think he's saying between the lines, you have to live with these elements of experience in order to be able to deal with them, to work with them. So any attempt to grasp them scientifically or scientistically, perhaps, is not so much doomed to failure, but doomed to miss something crucial. So as Guattari puts it, as soon as one seeks to quantify an effect, one immediately loses its qualitative dimensions and its potential for singularization, for heterogenesis, for the eventual composition of the haexeities that it promotes. For a thinker of the pathic such as von Weizsäcker, just to come back to him for a moment, contrasting the pathic with the ontic and endeavouring to grasp the unity of life as both a set of events connected in chains of cause and effect, which is what the ontic draws our attention to, and as an experience that is lived through, which is what the pathic draws our attention to, Guattari's affirmation would not be surprising. To take part in life, as one commentator on von Weizsäcker puts it, means to extend into one's own self as doctor and researcher the dynamics of sickness and recovery as experienced in the other person. So, I've got one more paragraph, and then I'll be done. Right? And then, so it's still, I've talked about the pathic here, I've talked about existential phenomenology, and I've talked a bit about how Oury takes up some of these ideas and how Guattari takes it up. I think there is I think a significant difference. If the pathic, which is concerned, as it is with movement, with sensation, with living in its unobjectifiable auto movement is only susceptible of an apprehension that is itself pathic, then I think it's fairly clear the inference there is that knowledge itself must become aesthesis, or to use Guattari's own terminology, it must become ethico-aesthetic. In this respect, Guattari's thinking about pathic subjectivation of necessity refuses to offer a stable ground on which to generate an analysis of the production of subjectivity. So Guattari's writing is kind of maddening, particularly the schizoanalytic cartographies. Now I think that my sense of that is it's partly about an evocation of a dimension of experience that it's not easy to put into words, which I think is what the idea of the pathic draws our attention to. The movement of existential appropriation that Guattari finds necessary to the production of subjectivity, and which informs his deliberate turn to the ethico-aesthetic, is a movement of difference. This idea of existential appropriation. It's about difference, heterogenesis, and singularization. So when you're working with affect in an institution, when you're working with the affective composition of the institution, you're dealing with an essentially mobile reality. But if in the taking on of consistency, the existential appropriation is a kind of contact, or at least a connection with sensation and movement, it is, or endeavours always to be, the grasping of the singularity of the precise concrete configurations, the specific atmospheres of the particular place, or the particular places and times with which one is dealing. Okay, I'll stop there.